Welcome to I Didn't Know That, a show about things I didn't know. And today I wanted to do a little something different and talk about compression socks. I have known relatives of mine that have used compression socks, and they typically have had diabetes. And I struggle with some foot pain, and I was working at Maple Log and I was on my feet a lot, and somebody said you should try compression socks, and it helped my pain in my feet from being on my feet all day. So I wanted to come to the expert, Matt Kaufenberg from Back in Motion Physical Therapy. He's a physical therapist here, and you may also see him on TV3's Wellness for Life program. So Matt, compression socks, what are the magical properties, and what are they helping? Why did that help my feet feel better?
Yeah, that's a great question, and a question that a lot of us really don't know the answer to. So really what it comes down to, quite simply, is it's all about circulation. It's all about helping facilitate blood flow. You know, if you're on your feet for a long day, if you're standing all day long, that a lot of times the blood can just kind of pool down at your feet and your ankles. You know, when our heart pumps that blood through our arteries. It's pretty easy for the blood to get to where it needs to go because gravity's helping it for the most part. You know, the blood can get down to our feet pretty quickly, but it struggles getting back because now it's fighting gravity. And so that blood tends to just pool. And when blood pools, you can end up with a little bit of swelling. And so when things start to swell up, they'll compress nerves, and you'll start to have some pain.
Okay. So, you know, is it okay that I wear compression socks even though I don't have diabetes? Is it only a requirement, or is diabetes the only requirement to wear them? Or?
Absolutely not. Compression socks can be worn by many, many people. They're very, very safe to use. You know, the cases in which compression socks are really needed are going to be people who work standing all day long. It's going to be like pregnant women often need to have some sort of compression, mainly because there's more blood volume when you're pregnant.
Okay.
And so you need to get that flowing better. Diabetics need really, really good blood flow. Diabetics, if they don't have great blood flow and the blood pools, they can end up with what are called ulcers, like pressure ulcers. And that's all because the blood is just kind of pooling in one area, and their bodies don't heal as well. And so you need to get that blood out of that area so that things can keep flowing and keep healing.
What are the socks doing? And I'm hoping you're maybe going to draw an example of what the compression socks are doing.
I can.
To your leg?
Yeah, I can.
Or are we going to play win, lose, or draw, or hey man, I don't know.
I'm not a great artist.
You
but
are.
I do think visuals do help to kind of tell us what's going on. So let's anatomically. Again, the heart pumps and it pushes the blood through the arteries, through the arterioles into the cell. And again, gravity helps. But one thing that's interesting about arterioles is arterioles have, and I can't quite draw this real well, but arterioles have a real thick wall. And within that wall, so you've got your blood flowing through the arteriole, and the wall of the arterioles are really, really thick, and in that wall is a really strong muscle. So the arterial walls have muscles that actually continue to contract and push that blood through down to the area that is needed. The veins are a lot different. So anatomically, blood goes from the heart to the arteries to the arterioles to the cell. And then once the cell is done with what it needs, it then pushes into what are called venules and veins, and that's what brings the blood back to the heart. Okay. Now, so the arterioles have a really thick wall with a lot of good muscle. Veins have a really thin wall, not a lot of muscle, so not a lot of strength. So you've got this blood, let's say this blood is all down at your foot, and it needs to get back to your heart. It gets back to your heart through the veins. But they don't have a lot of muscle within that, so it doesn't push real well. It's also fighting gravity. So what ends up happening is that blood just kind of pools. So you put a compression sock on. Why do you put a compression sock on? So we've got let's say we've got our vein down at our foot, We've got to get this blood to come up this way towards our heart. Okay. Again, remember, we're fighting gravity. Gravity wants to push that blood back down. We don't have a lot of muscle within the wall. So what we have designed by God is we've got these valves within our vein. So the valves are here, and when the blood pushes through it, it kind of automatically closes those valves. So within a vein, you've got open valves, the blood pushes it. Once the blood is above the vein, that valve closes and it holds it there. And then again, along the chain, again, you've got more valves that continue to hold it. And we keep pushing that blood through by large muscular contractions, so our leg muscles will pump and try to push it through. You've got little tiny muscles within the vein wall that'll push it through as well. But when you're standing all day, when you've been post-surgical, you don't have a lot of muscle contraction to continue to push that blood up. It's nice to have a compression sock. So that compression sock now offers pressure from the outside, and that squishes that vein and it pushes the blood up.
Okay.
And once that blood comes up beyond the valve closes and it's there.
And so it's not just any sock, it's a tighter...
Yeah, so there are a variety of socks out there. There are over-the-counter socks. You can purchase them on Amazon. There are certain socks that offer a little bit of compression. But then there are also socks that are going to be prescribed by a doctor that have a lot of compression. A lot of times that's going to be post-surgical patients who've had like a total knee replacement, a ton of fluid that needs to get pushed out of there. So a doctor will often prescribe a compression sock that has a lot more pressure than what you would get over the counter.
What about if you sit a lot during the day? Would that be helpful, or?
It would be helpful if you sit a lot, and that is more just that inactivity again. If you're not very active, the large muscles like the calf muscles and the thigh muscles, they're not pumping a lot. So that blood just kind of stays right there. And so if you have a job where you're sitting a lot, having compression socks absolutely helps push that blood.
I just think when I go travel, we were in Michigan, and I did wear my compression socks. I didn't know if they helped or not, but
they absolutely do.
Okay.
Just that little outside pressure can absolutely facilitate some blood flow.
Can you wear them all day, all night? How does that work?
It's best to use them during the day when you're at work, sitting a lot, traveling a lot. You don't need to wear them at night. You're lying down, you're not fighting gravity anymore. It actually would be almost contraindicated to wear them at night.
Okay. So, but I can wear them for, all day, an 8 hour or
you can.
10 hour. Okay.
Yep, absolutely. It's very safe to wear it all day.
Perfect. Well, thank you for answering my questions
Yeah, you're very welcome.
about compression socks.
Yeah.
Something so simple as compression socks, but I kind of was blowing my mind and how they work. So there's not something magical in the threads of...
There isn't anything magical.
All right, super. Well, thanks, Matt, for joining us on I Didn't Know That. That's Matt with Back in Motion Physical Therapy. Another quick question that I've always had, do you need to be referred by a doctor to see a physical therapist?
You do not. Most insurance companies do not require a referral to physical therapy. There are a few. Medicare is the big one. Medicare does require a physical therapy referral, but most insurance companies do not. You can come to a therapist directly.
A 2-for-1 on I Didn't Know
thank
That. Thanks so much, Matt. And thanks for watching I Didn't Know That. Oh, and I wanted to mention Matt is located in Perham and Park Rapids. So thanks again, and I hope you learned a little something today like I did.